When we think about sex and gender differences in healthcare research, we often think about physiological differences. And historically, a lot of the research that was done, the large studies were done in men, especially back in the 50s and 60s. And in the last 20 years, we've really tried to make that more equal. And so both men and women are enrolled in studies. And we try to look at things objectively. And so how are the way that we respond to different medications, for example, or to different treatments, different between men and women. But that's very much on a physiological sense. As a nurse, I try to think of things holistically and to recognize that the culture that someone grows up in, their environment, their socioeconomic status, their education, all of these things can impact how individuals respond to risks, how they access care, how they actually recover from an injury or from a chronic disease, even the kind of care that they will be able to have for the rest of their lives if they're an older person and have a chronic disease. And all of those factors are different often for men and women. So I think that it's very important in our research studies to not only look at physiologic differences and say, okay, men respond this way, women respond that way, but also to think about how are men and women's lives different in this population.